y'all, what's up? Sloan here. So I had a carpal tunnel release and an ulnar nerve decompression done to my right arm last Friday, and I'm making this video just to go through the process of everything that happened the day of surgery. So let's get started. So when we got to the surgery center, they are still not allowing any visitors in the building, so my husband had to drop me off at the front door where a staff member walked me inside, and I had a couple papers I had to sign, mainly just release forms saying that they could talk to him and kind of give him updates about everything that was going on. So once I finished all of those, the nurse called me to the back to the pre-op area, and when I got back there, things moved pretty quickly, which I was very surprised and impressed. It was very well organized. So I got back there and they put me in a gown and some of the little socks with the gripper things on them, and then I had to put a hairnet on, which, as you can see, I have a lot of hair, so trying to get all of my hair into the hairnet was quite the challenge, but we got it done. And then the nurse brought me a nice warm blanket once I got in the bed, which I was very grateful for because it is freezing cold in the pre-op area. So that nice warm blanket was great. And then once she got me situated in the bed, there was several people coming in and out of the room, lots of stuff going on. So let's see, the first nurse came in and she did vital signs, and she also put an IV in my hand. She also put the little EKG leads on my chest so they could monitor my heart and the rhythm during the procedure. And then she also gave me some pre-op medications and hung up some antibiotics and some saline. While she was doing all of that, I also had another nurse on this arm with the procedure. She shaved my arm from the wrist all the way up to basically where this ACE wrap is. So I can't wait to see what that looks like when I get this off, what my shaved arm looks like. But anyways, once she got that all shaved up, they also did like a betadine scrub from my fingertips all the way up to just above my elbow to get it nice and clean, get any surface bacteria off. So once she finished with that, the doctor and the nurse both initialed my arm, saying that this was the arm they were going to be doing the procedure on, and kind of went over and made sure that they were going to be doing the correct procedure that I had talked to the doctor about. So once they finished with all of that, I was pretty much ready to go. I just had to wait there in the pre-op area for a couple minutes. And the last person that came in was the anesthesiologist. She came in and went through what she was going to be doing once we got into the operating room. And they actually put me completely to sleep for this procedure, so I did have the tube put down my throat, which I was kind of scared about. I didn't really want to be put completely to sleep, but in the long run I actually was very grateful because I don't know how well I would have done if I was halfway awake and happened to look over and saw my arm open on the table. I don't do very well with seeing my own blood. I probably would have passed out, so it was probably a good thing they put me completely to sleep. Also kept my blood pressure down and anxiety level and everything down. So once they took me into the operating room, the last thing I remember was the anesthesiologist putting the mask over my face, and she said, "All right, take some deep breaths." And within maybe 30 seconds, I must have been asleep, because the next thing I remember is waking up and the nurse was standing at the bedside in the recovery room, and she was asking me how I was doing. And I was like, "Oh, it's already over?" Like, it had only been 30 seconds. But anyways, so I waited in the recovery room until I got myself back together. She brought me a Sprite to drink and had me take a couple sips of that, which I was also a little bit scared after having the tube in my throat to drink anything, because I wasn't sure what that was going to feel like. But I took some small sips and it was fine. So I didn't have any issues really drinking, which was good. And I didn't have any nausea or vomiting either when I woke up, which I was also very happy about. So once I got my bearings back together, she helped me sit up on the side of the bed and I got dressed, which, here, let's show you guys what this big old bulky dressing looks like. because the first thing I wanted to see when I woke up was what my arm looked like, and they had me all bundled up. They said I was shivering when I came out of the procedure. But anyways, this is what the dressing looks like. I have a hard, almost like a cotton thing right here, but it's pretty hard to protect the inside of the elbow. And then right here at the wrist, this is also like a hard piece. So as you can see, it's a pretty bulky dressing. It's also pretty heavy, but they put you in this, and then I also have been in a sling. It just keeps the arm up. That, or I put them on some pillows when I'm at home. But once they got my clothes on and helped me get ready, which the nurse was very impressed too, because I made these shirts that unvelcro. I put Velcro all the way down it so that I can put this good arm through and then put it over my head, and then I actually can Velcro all the way down the side, which has been great because my husband is at work all week and I'm here by myself trying to get dressed and everything. So we made these so I could get dressed in the morning by myself, which helps out a lot. But anyways, so once she got me dressed, they had called my husband and he came and picked me up. They went over some paperwork with him, and they had taken my IV out, which was the only thing left I had on. I think they had already taken the blood pressure cuff and all that off. And they told me I could eat or drink anything, so we got in the car. We went and had my medicine filled, and then while we were waiting for that, we decided we were going to go get something to eat. So I had some, I think I had some like chicken tenders or something I could eat, like a hand food or finger foods. So I ate some chicken fingers, didn't have any problems with it. I drank me a couple Sprites just in case I had some nausea, and then once my medicine was filled, I went ahead and took some of that. They told me to go ahead and take it pretty much as soon as I got the prescription filled, so I didn't have any breakthrough pain, which would have been terrible because I have had my pain medicine start to wear off and my arm started throbbing. But it's not been that bad, honestly. I also put some ice on here, usually in the evening, or if I'm just sitting on the couch for a little while, I'll stick an ice pack kind of down into the sling, which feels really good, especially right now. I'm on day 4, and this thing is itching so bad. I'm assuming it's from the sutures starting to heal up, but it is so itchy. So trying not to itch this is crazy, but if you just put like a little ice pack or something that's cool over it, it kind of soothes it a little bit, so you kind of forget about wanting to scratch it. It's extremely bad. As far as just pain level, I really have not had too much pain. I've been keeping it under control with pain medicine. I'd like to be completely off my pain medicine by the end of today. That, or just have to take, over-the-counter Advil or some Tylenol or something. As far as activity goes, I still can't do anything with this arm, so daily tasks are pretty tricky, and I am also right-handed, so that's also been fun, trying to brush my teeth with my left hand, and pretty much do everything like eating and all of that. And as you can see, I have a nice watch tan line, but I cannot get my Apple Watch back on my hand by myself, so it's just sitting on the couch for me to keep time with. But as far as everything else, I called the doctor's office, and they actually want me to keep this dressing on until my follow-up appointment next Tuesday, where I think they're going to take this off and look at the sutures and see if it's time for them to come out. So I'm stuck in this thing until next Tuesday, and very limited activity. I can't drive right now. So I went for a walk the other day, and that was also a mistake because it started to throb, I think from it being in a dependent position. So I got back home, and keeping it propped up on the pillows, that helps quite a bit. In the morning, I have like hardly any swelling in my fingers. I actually can move all my fingers as well, which is also good. That was kind of scary, them working on my nerves and then waking up. That was also another thing. I immediately tried to move my fingers to make sure that I could still move them. But other than that, whenever I get the bandage off and get to look at the incision, I may make another video so you guys can see my updated progress, and I'll just keep you up to date week to week with rehab and everything else. So with that being said, thanks for watching.